Hi everyone, welcome to the very first video post here at Spire Health Partners. I'm Kevin Ross, a registered nurse and the founder of the company. I want to actually talk to you about a service that we provide, but I want to put it in general terms. Whether you hire us to provide those services or you hire someone else, I want you to be able to make an informed decision. What I want to talk to you about today is health and wellness coaching. Now, if you visited our site, you can kind of get an idea from the general terminology that we've put up there regarding what health and wellness coaching is. It basically getting you from the start line to the finish line, ultimately the finish line being your goal. When people ask me what it is that I do, or one of the services that I provide in particular, the health and wellness coaching aspect, I basically kind of put it in a story for them. And so that's what I want to do for you today. So let's say that you visit your primary health care provider, nurse practitioner, physician's assistant, physician, doctor, whomever that is. Let's say that it's your annual physical, wellness exam, or let's say that you've had a nagging symptom going on for a while and you've needed to check up on it. So after speaking with your healthcare provider, they've made the assessment, maybe they've gotten some lab work or some other diagnostic performed, and you speak with your healthcare provider, and the results are, well, you need to lose weight, your cholesterol's through the roof, you're at risk for a heart attack, you might be pre-diabetic, you're at high risk for a stroke, on and on and on. Now, of course, not everybody gets that kind of news, but some people do. And then, of course, you're walking out of the office after talking for a few minutes with your healthcare provider, walking out of the office with a couple of prescriptions and maybe a few pamphlets on diet, exercise, and living better. Now, of course, all due respect to these healthcare providers, I think they're really trying to do the best that they can possibly do with the limited time that they have. This is where the benefits of a health and wellness consultant can come in for you, because ultimately you're leaving that office devastated with these new medications that you don't know exactly what they're going to do. You hear all of these TV commercials of the side effects and the issues with them, and then of course all these pamphlets that you're trying to work through, and really, again, you're just devastated, and you may be initially motivated to want to make a lifestyle change, eat better, exercise, sleep well, get enough sleep, lower your stress. And of course, patients tend to do these things, but it kind of putters out after a couple of weeks because they just don't stick with it. And so I want to talk to you today about what kind of health and wellness coach that you might be looking for, or who are you actually interviewing when you're seeking out these services. Now, let me first say that as a registered nurse, I have the training and experience in traditional medicine, of course, knowing the medications that you're probably prescribed, and of course the diagnoses that you've received. I know a lot about the complexity of the diagnosis or multiple diagnoses that are occurring. And so keep that in mind when you are seeking out services from a health and wellness coach. Are they an individual, a professional that understands the traditional aspects of medicine? Now, another benefit is that I do have training and experience with alternative therapies as well. Now, of course, I'm not a naturopath, but I am very familiar with a lot of the treatments, the therapies in alternative medicine. And quite frankly, my philosophy is, our philosophy here at Spire Health is that we feel that traditional and alternative you can have a synergy there where they can meet in the middle, and certainly you can have both aspects and live a good life. So just keep that in mind when you are interviewing your potential health and wellness consultant, that are they well versed in the traditional medicine, and are they versed in alternative if alternative is something that you want to take on. Because essentially the way I try to approach it is that sometimes patients will initially need those medications that were prescribed by their healthcare provider. And see, I do work in collaboration with those healthcare providers. I understand them, and I can talk the clinical, speak basically, and provide the updates and the assessments to them in a way that they understand. And so I don't necessarily say, like, let's go ahead and get rid of all of this traditional stuff right away. We've got to get rid of this and do this. I'm not about diagnosing and treating in that aspect. Again, it's a collaborative environment, and I ultimately defer back to the primary healthcare provider. And so make sure that when you are interviewing somebody, they're not looking at those prescriptions saying, okay, no, this is just terrible, this is awful, you can't do this. Because sometimes patients do need it to get them to a point where things are a little bit healthier for them. And so it doesn't necessarily mean that you're going to stay on those medications permanently, but again, you might need some of them permanently. It just depends on what has occurred with you. So again, part of the informed decision is, what is the philosophy, what would be the philosophy of the particular health and wellness coach that you're interviewing? And of course, like I said, I like to blend the traditional and the alternative if and when possible. But again, health and safety is priority one, and it should be for every professional out there as a health and wellness coach. So interviewing, ask those questions. Are you certified to do something like this? What is your license? What is your background? What is your experience with health and wellness coaching? Do you have references? I mean, here at Spire Health, we've worked with several patients, and we try to keep a log and a database of patients who have participated in our services or been part of our services, and we like for them to give feedback so that we can not only better ourselves, but also provide that feedback to potential clients. So again, as a potential client, a patient, don't be afraid to ask those really hard questions, because ultimately, if someone can't answer those completely, or you feel like they're just not being very transparent or informative, again, you're putting your life in their hands. So don't hesitate to just kind of stop it right there and move on and interview someone else. So, I mean, someone reputable should be able to provide these services. And again, we pride ourselves on being able to collaborate with a full medical team, again, because we understand the complexity going on here. And so we're able to articulate, communicate to the primary medical team when it comes to what we're doing and what they're doing and how we can work together. Because ultimately, even if I don't know the answer right off the bat, like if you ask me a question and I just don't know the answer, I'll either find it or I will find someone who does, or point you in the direction of that particular professional that can answer those questions or even provide the service to you. Now, lifestyle changes occur in the way of better nutrition, exercise, and of course, lowering your stress, work-life balance. Again, we try to address all of those issues, but we do it in a safe and healthy way, because ultimately this is going to be something that you're going to have to adopt over a period of time. It's going to take some time. This is something that you cannot jump in head first and expect these amazing results. So what we try to do is evaluate you from head to toe, and of course gauge your interest and your motivation, your willingness to stick with this program. But see, part of having a health and wellness coach, we're helping you along the way, because essentially patient compliance pretty much goes down pretty quickly when these individuals don't have someone helping them out through the process. And so we try to help increase that patient compliance. So just keep that in mind. That's one of the benefits of having a health and wellness coach. So don't be afraid to ask those hard questions, and don't be afraid to walk away from a potential situation that you just don't feel comfortable with. But do keep in mind that when we are selling our services, we are looking here at a longer term situation. This isn't going to be something like a program where we're going to be able to give to you and then you kind of do this by yourself. Again, we're going to be with you along the way. And part of that transparency is to kind of tell you what we think is going to work for you. And of course, it's hopefully mutually agreed upon. Now, one thing that I also want to transition into as far as the exercise piece here is that There's a woman who not necessarily pioneered this, but Lori Radcliffe, who started fitness nursing. And I don't want to say she started necessarily. I mean, she admits that she read about it, but she's really kind of out there developing this fitness nursing program for nurses who want to get into the health and wellness industry and provide fitness services, training services, if you will, for individuals who have certain diagnoses that they specifically want to work with and they're comfortable with. I'll give you an example. I have a very extensive cardiac background as a nurse, and I understand cardiac rehab. I understand if what valve replacements involve, or bypass surgeries, or even heart and lung transplants. I understand those. I've worked with those types of patients. I understand what the therapy entails. I understand the medications. And so I would promote myself as a cardiac rehab fitness nurse, or just a cardiac fitness nurse. So someone who is able to work with someone who is either recovering from a heart attack or, again, some type of surgery, and being able to take that fitness background that I have and putting it into a program for my client and addressing their needs, but in a safe way, rather than this individual going to some other health club. And in all due respect to these health and wellness coaches, and of course the personal trainers, again, I'm not trying to take a dig at them. I'm just saying that I'm very familiar with the medications and the therapies, and so I can work with that patient specifically, either one-to-one or in a group setting, and being able to address their needs and not hurting them. And so doing it in a way that their healthcare provider would want it to be done, because ultimately going to the gym and having a workup by a trainer that doesn't know these things, it could be disastrous. But again, all due respect to them, I don't want to, provide this sort of negative cloud, or put this negative cloud over, fitness trainers, because again, we all have our place. And so fitness nursing, again, is a nurse who's either been a trainer before or has some kind of kinesiology background, physiology background, and maybe they later became a nurse, and then they're kind of getting back into this whole fitness and training piece. Or maybe they've been nurses and they've taken courses or training in becoming a group or personal trainer, athletic trainer, or some form of kinesiology, whatever the background. Certainly ask those questions. But again, I don't want to get too involved with fitness nursing. I would actually like to collaborate with Lori on helping promote that business, but I really just kind of want to get back to just focusing on this health and wellness piece and letting you know that you need to make these decisions, make an informed decision. So you need to have all of those answers before you make those decisions. So again, like I said, make sure that the individual that you're going to be working with understands what you're going through, the diagnosis, the medications, the prognosis, and what's the treatment plan here. And so, again, I do work with all healthcare professionals, whether traditional or alternative, and I sort of go into it with an open mind. And again, each patient is an individual themselves, and so it's not a one-size-fits-all. So I don't try to force an individual to fit into a program that they're particularly just not fitting into. And so I do want to be open about that up front. And so, like I said, we look at it on a case-by-case basis. And so I guess I want to just leave you with health and wellness coaching is going to help you get from the start line to the finish line, help you achieve those goals of weight loss, adopting a healthier lifestyle, a better work-life balance. And it's going to do it in a way, depending on the practitioner that you're working with, doing it in a way that is priority one, safe, and the healthiest for you. So make sure that you are doing all of your research and your due diligence when you're interviewing these individuals. And I'm available by consultation either via email or by phone. And certainly I like to answer all those questions up front initially in an initial consultation just so that we can kind of open things up and clear the air. So anyway, health and wellness coaching in a nutshell, maybe a bigger nutshell than I probably had anticipated when I first started recording this video. But anyway, I appreciate you watching, and we hope to have more videos up here in the very near future about other services that we provide, but just in general, just health and wellness topics that we just like to discuss here. So thanks so much for watching. Feel free to comment, and just be well.